Hello, everybody. My name is Li Zhao. I'm a fellow from the University of Illinois at Chicago. I am here attending ACC 16 in Chicago. Standing next to me is Dr. Rogers from UC Davis.
Hello.
And next to Dr. Rogers is Dr.
Brian Wisenant.
Yes.
Nice to be here,
Welcome
Lee.
to
Thank you.
ACC. Thank you. Yes. So we would like to ask you two a few questions regarding, the left atrial appendage closure devices. What do you feel the most challenges you have for these devices to prevent strokes in patients with atrial fibrillation? Dr.
Well,
Rogers first.
Yeah, I mean these devices are a new and exciting way to provide a therapeutic option for patients who normally would take anticoagulation, but have some bleeding problem that does not allow them to take long-term anticoagulation. So the devices in that sense provide an option that was not previously available.
True.
And I think the challenges with any new technology are always to select the appropriate patient for the therapy.
I see. What do you think, Dr. Weissman?
I agree. There's a huge unmet need to provide appropriate therapy for many patients who are not good candidates for long-term oral anticoagulation. Today we're working through some of the reimbursement issues still, but that's coming into place, which is really wonderful news. We have exciting new registry that will provide a lot of long-term data. We have a lot of new devices on the horizon, and I think that I think of the FDA approval and reimbursement as really being the launch to a new field with a lot of new research and a lot of new data so we can understand how to best treat these patients. It's exciting times.
Thank you. And also, what do you see the future of the left atrial appendage closure devices? Dr. Rogers?
Well, the future, as Brian said, is going to involve newer devices that are potentially easier to deploy, potentially safer, maybe more effective at excluding the appendage over time. And I think that new clinical research is going to be very important to expand the indications for these devices.
Okay. What do you think, Dr. Weissman?
We'll have new data understanding if we need a warfarin bridge for 6 weeks after device. We don't know that for sure at this point. That's important. We need to compare the devices versus novel oral anticoagulation. And we need to understand if the reduction in disabling stroke and cardiovascular mortality that was observed in the Watchman meta-analysis, we need to confirm that with more data because that was important.
Great. And also, being so successful in your career, I would like to know what your advice is for, fellows in training to get into the leadership and being successful in their careers too. Dr. Rogers?
Well, I would say pick something that you're passionate about and you enjoy. Because if you don't enjoy it, that's really the key. So something you're passionate, enjoy about it, and put your efforts into it. And doors will open, and you don't know when they'll open, but when they do open, you want to make sure that you walk through the door and take that opportunity.
Great advice. How about you, Dr. Weissman?
I agree with Jason. Cardiology is a wonderful profession. I've very much enjoyed my career and very appreciative to the mentors who have opened doors for me. And it's just a great place to be. And I'm sure as the next generation, I hate to think that I'm the last generation, but it's exciting to see all of the new cardiologists who are doing wonderful things here and capitalizing on their opportunities.
Great. And my last question to you two is, from this ACC 16, what is the most exciting science you find? Dr. Rogers first.
I think this interview may be the most exciting thing that's happened to me, definitely
Thank
today.
you.
So I'd rate this very highly. The meetings are about interaction and learning from your colleagues, and that's really the focus of the meeting. So it's the human interaction. Not just in the lecture hall, but here, milling about is really where, I would say most of the learning happens.
Thank you. How about you, Dr. Weissman?
Well, I'm completely energized by the intermediate risk data coming out of the partner trial and just how the opportunity of providing patients with such a low-risk, non-invasive procedure is really wonderful. It's exciting.
Thank you too so very much for
Thank
this
you.
interview. Thank you for your
Good luck.
time.
Thank you. Thank you very much.
Thank you.
Great. Great.
Good to see you.